Jr., the Mount Olive Missionary Baptist Church, and we are proud to be sponsors of the Wake Up.
Welcome. YDU Community Room.
We're also going to talk to another breast cancer survivor. Her name is Miss Erin Champion, and Miss Champion is the navigator for breast cancer patients at Cape Fear Valley's Breast Cancer Center. And she is also, like I said, has her very own story to share. We also have a physician assistant with us today. Her name is Hunter Hudson, and we have Dr. Paige Perez with us today. They are new to the breast cancer team at Cape Fear Valley Health, so we're going to officially welcome them to the community. Now, remember, Cape Fear Valley Health's Making Rounds Live. This broadcast is for informational purposes only. This is not a time for you to self-diagnose. Now, if you find anything that we talk about today that you or a family member or a friend may have or may suffer from, what I want you to do is find yourself a healthcare professional. Finally, if you're following us on Facebook, please share the broadcast. The reason why we're going to discuss some very interesting information today. You don't need to be that messenger, because if you're like me, you always lose something and miss something in the translation. So what we do is share the broadcast, then you can sit down or walk or work out and listen to the broadcast. Now, as many of you know, I am a breast cancer survivor. Now, without going into the long story, what I will tell you is I didn't have any of the regular symptoms. I didn't have any lumps. I didn't have any bumps. I didn't have a history of breast cancer in my family. But I had this funny feeling in my left breast. Now, this is the strange thing. I was at my hairstylist, and my hairstylist said, Omega, you have something going on internally because you have long strands of hair coming out. You need to go to the doctor and get yourself checked out. So I brushed it off like everybody else, but that discomfort that I felt in the left breast, it got stronger and stronger and stronger, to the point where I was walking around cradling my breast, and that just didn't look right in public. So I went to my physician during that time. Her name was Dr. Shirley Tan, and Dr. Tan asked me when was the last time I had a mammogram. Embarrassingly, is that a word? But it is today. I told her it had been 5 years since I had a mammogram. She said, aye, like she usually did. And she scheduled a mammogram. Well, after that mammogram, they found 6 calcifications, tiny calcifications in the nipple of my left breast. Now, I'm going to share the rest of the testimony later, because what I'm going to do now is bring in Miss Erin Champion. Miss Champion, she is the breast care patient navigator for Cape Fear Valley Health. Basically, Miss Champion, she holds the patient's hand, as you might as well say, after that initial diagnosis, after that initial kick in the gut. And she walks them through the process. We're also talking with Ms. Hunter Hudson. She is a high-risk clinic provider, and she works with patients who have an increased risk of developing breast cancer in their lifetime. Now, we're also going to talk to Miss Paige Perez, Dr. Paige Perez. Let me get it straight. And Dr. Perez, she is the medical oncology pharmacist and educator. And that basically means that she educates patients on before and possibly during their treatment. She talks to them about the treatments. She talks to them about the medication. She talks to them about the therapy. So ladies, let me officially welcome everyone to Cape Fear Valley's Making Rounds Live.
Thank you.
Now, early detection, that is what saved my life. We hear how important it is, but sometimes I know it's hard with our schedules. There's so much going on, but we've got to get those regular screenings, people. And I'm not just talking to ladies, fellas, I'm talking to you too.
Absolutely.
And so, Miss Hudson, we're going to start with you. Once you get, one of the key words is regular. Every year, once a year. Why do we need to get those screenings regularly?
So you get screenings regularly because unfortunately breast cancer affects 1 in 8 women. So there's 1, 2, 3, 5 in the room right now with 2 survivors. And so the important part about regular screening is that this is a very, very common cancer. And the only way to catch it, unless you feel it yourself, is through mammograms.
If a person had a mammogram last year and if it was clean, does that mean they need to skip a year?
Unfortunately, it does not. Some cancers, we like to describe it to patients as they're all different flavors of cancer. And so you have these slow, kind of lazy cancers that take their time to grow, but then you also have the other end of the spectrum of that as well. You have fast-growing cancers in the breast. And so the only way to make sure that even though you had a clean mammogram the year before, to make sure that it still looks normal, the year after is to get another imaging study as well. Mm-hmm.
We turn on the news. Every time we turn around, the guidelines are changing about the mammograms and when to get them and how often to get them. So what are the current guidelines for who should get a mammogram and when?
So there are a few different guideline bodies that provide recommendation. The one that we use at Cape Fear Valley is the National Comprehensive Cancer Network, or NCCN, and those guidelines tell us and they recommend that all women starting at age 40 should get yearly mammograms. So some say starting at age 50 and every 2 years get a mammogram, but we go by the earlier age, which is 40, and then yearly mammograms after that. And then they should go on as long as the patient is healthy and is physically able to get mammograms. There's no upper age limit of mammograms that we say. Mm-hmm.
All right. Ladies and gentlemen, we're having a very interesting conversation with Ms. Hunter Hudson. She is the high-risk clinic provider for Cape Fear Valley Health's breast care team. Right now, talking to her on Cape Fear Valley's Making Rounds Live. Ms. Hudson, how long does an average mammogram appointment take?
So I have never had one myself, but what I've heard from patients is an average mammogram appointment, the actual imaging itself should take about 15 minutes for both breasts. And you usually get the results of a screening mammogram around 2 weeks after the imaging study is done. That can depend on who's reading it and where it's going. But I was going to ask if anyone else that has had mammograms in the room have had that similar experience.
You see, this is where we need to give Lindsay a mic, because Lindsay told us before the broadcast that she had her first mammogram, and we should get her a microphone and ask
really
her.
should.
But but I will say, as far as I'm concerned, I know that when I get mine, they tell me wait a few minutes, and then they come back and they'll say, okay, everything is fine. We'll see you next year.
Yep.
And that's pretty much how easy it is. I don't even think it takes 15 minutes, to be honest. The longest I think I've been in there is 15 or 20 minutes. Erin, what about you?
So I'm another tricky one. I didn't have any mammography before I got my breast cancer diagnosis because I was under the age of 40.
Oh. All right, so since you've opened up that box, let's talk
Yeah.
about it.
Yeah, so I actually found I was pregnant at the time, and I was in the shower and I was doing my normal routine, and I brushed my arm across my breast to shave my armpit, and my hand just hit just right, and I found a mass.
Wow.
And I quickly rinsed off, got out of that shower and called my OBGYN and got in that afternoon for an ultrasound. Yeah, kind of crazy to think about.
So you just can't say that and just leave us hanging like that. Tell us the rest.
Okay, so the rest is I'm here healthy and well 8 years later. But I did alert my care team immediately. I got the necessary imaging. I had a heart-to-heart conversation with the radiologist in the room with the ultrasound, with not a strong family history and kind of this coming out of, left field, I guess you could say. There wasn't this huge concern about it.
Yeah.
I had nursed my first baby a long time and my second baby equally as long. So I was a breastfeeding mama, so that kind of just puts you in this, probably related to that. Because that wasn't their alert system, I also wasn't thinking at that point that it was cancer. But as we talked more and more, and we talked about women getting breast cancer in their lifetime, and we talked a little bit more, I did end up taking a deep breath, praying for some courage, and saying, what would you think if I asked for a biopsy? Because you're releasing me to manage this, and my anxiety may get the best of me, and I'm not sure I can manage this. And so I need this fear of the unknown to get shifted to what is known. And whatever that is, I'll take the steps to deal with. And ultimately, it was a breast cancer diagnosis. I went through surgery and chemotherapy and radiation, still on hormone therapy today. And I am one of, those survivor stories that you face that diagnosis. There's treatment for it.
Yes.
There's care for it. We've got a phenomenal community of care. And you, as Omega, we were just talking about earlier, at some point, and I stole this from Dr. Sawyer, it's a rear view mirror story where
Dr.
it's
Sawyer's
no
amazing.
longer in front of you, it's behind you.
Yeah.
And you and I were just talking about how many years has it been? And
We
we're
had to
counting on
actually
fingers.
think, and I remember once upon a time, it's been a year, it's been 2 years, it's been 5 years. Now it was like, wait, I had to actually count.
Yeah.
So I get it.
Yeah.
But you were pregnant.
Yes.
So
Yes.
how did the baby,
So she's amazing. I have 3 amazing babies.
Okay.
She is 8. She uses the opportunity of her being in my belly when I got diagnosed to publicize to anybody who will give her time to listen to her. October is like her second birthday month. She wears pink nonstop and says, I'm a survivor. Oh, look, Mom, there's a commercial for us survivors.
Oh, I love it. I love it.
She did wonderful. Yeah.
Ladies and gentlemen, as you can see, we are having a fantastic conversation with Miss Erin Champion, Miss Hunter Hudson, and Dr. Hold on, I have her name right here. I am so sorry. Dr. Perez. There we go. And we're talking breast cancer awareness. We're sharing testimonies. And so now I've got to get back because I know that the producers are like, can you get back on subject? So if there are any women out there, is there anything rather women can do out there before or during their appointment that will make the process run smoother, or it'll help the technician maybe get a better image?
I believe this question is for me. Is that correct?
Yeah,
Okay.
yeah, it is for you. I'm
All
sorry.
right. No, that's okay. So, yeah, I would just defer to the mammogram technician themselves. They are, they are trained in getting good imaging. The machines are created to get good imaging. I think for the patient, for yourself, going into that appointment, I think the biggest thing is just try and take a deep breath and kind of relax through it. Try and be still during the imaging process. But I think just trying to decrease the anxiety of walking in those doors to try to get imaged is the main focus for the patient themselves.
I got you. Self-exams. I remember once upon a time, that's all I ever heard, self-exams, self-exams, self-exams. I don't think I hear it that often anymore. How do you recommend patients do a self-exam, and how often?
So yeah, the guidelines are kind of fuzzy on self-exams even still today. The NCCN guidelines that we use actually have, also vague guidelines on self-exams. But it's always just very important for the patient and for women and men to know what their normal breast tissue feels like. Because in a case such as Erin's, it's not always the mammogram, or you're not old enough to get a mammogram in order to diagnose breast cancer or anything that's going on suspiciously in the breast. So it's always very good to, breast tissue is kind of lumpy and bumpy as it's made, and so to know what your normal lumpy, bumpy breast tissue is, so that if something ever comes up, you're very keen on finding it and knowing that, hey, this is abnormal for me. So I think just overall, generally, once a month, women should do a quick breast exam just to kind of feel what's going on, what their normal is. And then if they were ever to find anything suspicious, a mass or skin change, dimpling of the skin, a rash on the breast tissue, then to absolutely alert your medical provider as soon as possible. Another note, if women are still menstruating, self-breast exams are best a few days after the menstrual cycle is complete, because sometimes during our menstrual cycle our breast tissue changes, so you can kind of get false positive breast exams.
What about women that have gone through menopause?
Going through menopause, I would do just a year or a monthly exam as well, just like anyone pre-menopausal as well.
All right. A high-risk clinic provider for Cape Fear Valley Health breast care team, Ms. Hunter Hudson on Cape Fear Valley's Making Rounds Live. We're talking to her right now. And if you have any questions, what you can do is call WIDU at 910-483-6111. And that's if you're listening on 99.7 FM. And if you're not from around here and you're watching the live stream, what you can do is leave the question in the comment section of today's broadcast, and Lindsay will make sure that we get that question to these ladies while they're here today. Ms. Hudson, let's talk about family history. It plays a very important role, but in my case, and in Erin's case, we didn't have a family history. So what are other risk factors that can affect women when it tells us when a woman should start getting a screening?
Absolutely. So family history absolutely plays a very important role in when we decide a woman should have a mammogram. In the role of family history, you should always start your mammograms at 10 years prior to the youngest age of diagnosis of your family member.
Wow.
So if a family member were to get diagnosed at years old, then